Hello, I'm Dr. Sanjay Panicker. I'm the founder of Amrita Homeopathy. We have two clinics, one is in Koramangala and the other one is at Marathalli in Bangalore. We specialize in hair and skin problems, respiratory problems, allergies, pediatrics and infertility. I have also authored a book on pediatrics. Yesterday was the book release. This is on pediatrics drug pictures, that is, it gives an idea about how to prescribe for children. And it is an illustrated book with a lot of pictures in it so that it's easy for doctors and for others also to understand how to prescribe in pediatrics. Mouth ulcers are very common and we find that there are 3 or 4 reasons why patients may develop mouth ulcers. The most common reason which a doctor would tell the patient is deficiency. Deficiency of B12, folic acid, iron is found to be associated with mouth ulcers. These mouth ulcers are also called as stress ulcers because they come up when you are stressed. When you are stressed, your B12 value dips, you start eating less, maybe you become little deficient in certain things over a period of time, and stress is known to trigger certain changes in your body which makes these ulcers to come up. Stress need not be only mental stress, even physical stressors, like for example after an injury, like maybe the sharp edge of a teeth or a denture, or maybe the toothbrush which can injure the inside of your cheek, or it can be biting your cheek, which might be one of the trigger for a mouth ulcer to develop. You can also develop mouth ulcers by having maybe a very hot tea or a very hot soup can burn your mouth and subsequently an ulcer may form in that area. Mouth ulcers can also come up by certain strong medicines, like chemical injury, that is, if you take up strong antibiotics or certain reaction to certain medicines, then these kind of ulcers may develop. Again, if you look at it, it can also be seen in certain diseases like celiac disease, in ulcerative colitis, and certain conditions where ulcerations form inside the intestine. Even after fevers like typhoid or major fevers, you can have mouth ulcers developing. Mouth ulcers can also be seen in certain deficiencies like herpes simplex, and if you have a H pylori infection, and in oral candidiasis. These are the multiple reasons why you may develop ulcers in the mouth, and the treatment has to be according to it. The major remedy which is used by most homeopathic doctors is borax, but I would say that it is rather abused than used. So it is always better to treat the condition symptomatically based on the presentation. By looking at the ulcers itself, sometimes you can get an idea about the remedy. There are multiple remedies which can be used in ulcers. Like belladonna is very useful in ulcers which are very inflamed and reddish. Epismel is useful in ulcers which are little having a purplish color. Even arsenic has got a purplish or a bluish color. Usually in lichen planus leading to mouth ulcers, arsenic can be useful. Calimure is useful in ulcers which is having a whitish base. Hepar sulf is useful in ulcers which is having a yellowish base, and silicea is also useful in such cases. Now, which one to take when you have this kind of ulcers is again dependent on the individual physician's discretion. These are only few medicines which I mentioned, but there are almost 50 to 100 medicines which we need to analyze and differentiate before we actually prescribe. It's always better to differentiate and prescribe rather than blindly giving medicines like borax. So that is usually classical homeopathy, and that's what I practice.